While AI has been revolutionizing healthcare, working along physicians in doctors' offices, assisting them with scheduling, disease prediction and prevention, and much more, for patients seeking medical advice online, AI may be prescribing the wrong advice. Joining us now to discuss the importance of consumers trusting the health information they seek and answers they are provided is Valerie Fuller, American Association of Nurse Practitioners President. Good morning, Valerie. Thanks so much for joining us.
Good morning. Thank you for having me.
All right, is there some healthcare information AI is more accurate in providing?
Not necessarily. What we did a survey late last year that showed that Americans are using AI and the internet for healthcare and information more than ever. And what the survey showed was that while access to information has truly exploded, the confidence in the information they're receiving just hasn't kept up. So only about 12% we found trust online information, and only about 5% trust AI tools.
I gotta say, I'm with you. I'm still leery. I mean, I know AI is here. We have to deal with it. I'm still a little bit leery myself, my friend. But I'll just say this. What healthcare information can AI provide that might actually be helpful?
Sure. So what I tell people is it's a great starting point. Or it's great to clarify something that perhaps you've already spoken to your provider about, but you need to make sure you're using trusted sites. And so my recommendation is to check the sources that AI pulls from. So sometimes you see those little gray bubbles next to the information. Click on those, see where that information is coming from. And then also trust. I tell people, start with AI and then perhaps go to other more reliable sites like for example, if you're looking up diabetes, the American Diabetes Association has great information. But most importantly, connect with your nurse practitioner to talk about what you're finding online, to clarify it, to make sure that the information you're getting is accurate.
Yeah, I totally agree with that. Is there an important role AI provides in the healthcare industry overall?
Yeah, it's filling some niches that have long been ignored. So particularly the paperwork burden that many healthcare providers face. But you even mentioned one, scheduling. That's another one where AI can help us recognize patterns. And it's also been used for many years in certain settings within the hospital, for example. So we have long had AI like or artificial intelligence systems that can detect patterns. For example, when people have something like an overwhelming infection called sepsis, AI can look at the things like the vital signs. Is the temperature going up? Is the heart rate been up? Is the white blood cell count, which shows us infection, rising? And it can alert us that, hey, maybe this person has an infection, and it will help us intervene earlier. So it certainly has some value.
That is valuable right there. So
Yeah.
any other tips on how people can be assured of the validity of the health information they do receive?
Absolutely. Again, check the sources that A is pulling from. There's a couple, but there's many more, coming to the market in terms of AI. The few that I've used are Doximity. That's one. The other one is Open Evidence. Those tend to pull from reliable sources. For example, journals that are peer reviewed and evidence based. So those are two good sites to look at. Those are the ones I see people use the most. But again, many more coming.
And do you think, overall, long term, the healthcare information AI provides can improve over time and cause people to be more confident in what they read online because it's improving?
That's the hope, is that the more good information we get into these systems, the better they'll become. The problem is, and this is something they say in research a lot, garbage in equals garbage out. So if not good resources are going into these products, not good information is going to come out the other end. So certainly the hope is that as these get better and better information ends up within the system, they'll continue to improve.
Well, Valerie, I've always been told don't Google your symptoms because it's going to tell you you're dying anyway. So I was like, I'd rather talk to my nurse practitioner, to be honest with you.
Absolutely. And this is really where nurse practitioners are the solution. We're trained to educate, we're trained to communicate, and we're here to help you guide your decision making. And we really focus on spending time with patients, and our education and our practice is based in whole person care. So we really do want to sit down, talk to you, and talk about what you found online or AI.
Absolutely. Is there a website or any place people can go, our viewers can go for more information on this?
Absolutely. Go to www.aanp.org, and there's more information that you can find there.
Well, thank you for all the great information, Valerie. Thank you so much and have a great day.
Thank you. You too.